First and foremost, I am a St. Louis City native, North St. Louis City. I grew up in St. Louis, went to Metro High School, and always really had a passion for healthcare and helping underserved populations. I did really well in chemistry, science, and math, and that led me to a career in pharmacy. Currently, I serve as the Senior Vice President and Chief Operating Officer for Affinia Healthcare. In that role, I oversee all of clinical operations. That includes nursing services, unhoused services, quality improvement, accreditation, pharmacy, radiology lab, all of ancillary services. So basically, everything clinical operations is what I oversee. Related to COVID, I was the lead with the testing efforts at the beginning of the pandemic and throughout the pandemic. So those projects were basically to get testing readily available in underserved communities, and that included North St. Louis City, South St. Louis City, and North St. Louis County. There was limited testing at the beginning of the pandemic in those underserved areas, so Affinia Healthcare really stepped up and provided those services. My role was definitely in the planning process, a lot of the implementation of our policies and procedures, specifically assuring that our staff were safe during the testing, and also the partnerships. So lots of collaboration with local community organizations, political leaders, worked very closely with Senator Steve Roberts on a number of testing events. So the collaboration piece really helped us to be effective with the COVID testing. The vaccination is just an extension of the testing that we were previously doing. Testing continues because unfortunately the Delta variant is also spreading in the state and throughout the nation. So testing efforts continue, but right now our main priority is vaccination of underserved populations in St. Louis City and County. So currently one of our priorities is vaccine hesitancy and just increasing the education and the trust that individuals in the Hispanic and the African American community have in the medical system so that they can feel more comfortable receiving vaccines. And it's not just the COVID vaccine, because we see this with all vaccines. We see hesitancy with the flu vaccine in minority communities as well. So a huge priority is being present in the community, not just talking the talk, but actually being present, letting the community know that we actually care and that we provide high quality health care. What I say a lot is that it's always about who's next. So what I view as success or excellence is growing the new pipeline or the next pipeline of Dr. Kendra Holmes. So it's very important for me to mentor individuals, to assure that my staff, our team is receiving the proper encouragement, education, training so that they can, be the best employees that they can be, and also to motivate, younger people so that they can realize that there is, a great career in healthcare. I think it's always important to measure your success by not just your personal accomplishments, but how you've touched other people and how they have also been successful. Because I see, again, the North Star is health equity and the fact that individuals deserve, healthcare is a human right. It's not a privilege that should be to individuals based on their income or their demographic. Healthcare is definitely a human right. I would like to thank, first and foremost, my family, my friends, also all of our team at Affinia Healthcare. This award is not just a Dr. Kendra Holmes award. This is representative of all of Affinia Healthcare. My CEO, Dr. Alan Freeman, my Chief Medical Officer, Dr. Melissa Tapey. All of us have worked tirelessly to help the community, and this goes to all of them.